Welcome back. You're watching Startup Central with me, Nantara Ryan. This is a show where we celebrate innovation as well. IIT Delhi has come out with perhaps the world's cheapest COVID-19 diagnostics test. I'm going to now talk to the makers of that test. First of all, it costs 399 rupees. You heard me right, 399 rupees. Joining me to talk about this is Professor Vivekananda Perumal from IIT Delhi, as well as Professor Menon, again from IIT Delhi. Thank you, professors, for joining us right here on Startup Central. Professor Perumal, I'm going to come to you first. 399 rupees is the starting price. The HRD ministry has been very excited. The Modi government has been excited. I want to ask you a question first up for all those who are tuning in. The other test costs 4,500 rupees minimum. This 399 is not a subsidized price. How did you innovate this? Can you tell us a little bit about it?
So the 4,500 is first. I'd like to tell you that the 4,500 is probably not perceived in the correct way. So the 4,500 test price consists of collecting the swab, transporting the swab in a and then doing the RT-PCR. So these are the components. So all put together, along with lab overhead charges, costs about 4,500 in some places. Some other governments have made it a little bit cheaper. It even works out to 2,500 in some places. But RT-PCR testing. So around 550, 650, or a little bit more expensive than that. In $399, and they can probably get it lower when they start manufacturing it in bulk. Hello.
So, Professor Menon, if I can now come to you, we can hear you, Professor Perumal. I'll come to Professor Menon now. It's a question I'm sure you would have had to answer many times over, but now that you're here on ET now, talk to our viewers, sir. World's cheapest test, you take away the, the collection, the price of the swab and all of that. What is the accuracy rate of this test?
So, till now, whatever analysis we have done, we have made it sure that it matches, if not betters, many of the kits which we have in the market. So, most of the ICMR in the panel what they've tested, so first we have got is 97. 200. So that's somewhere on the best category of all the tests which we have in the market. So we are not really compromising on the sensitivity or specificity at all.
But you're not compromising on it. But Professor Perumal, is it as good or is it better?
I mean, there is a range that ICMR keeps. When we submitted our kit for validation to ICMR, we got a report saying that it's 100% sensitive, 100% specific. The best it can get. So we won't comment on. There is a range. You can actually be slightly below 100 and still be approved, but we were at 100.
Okay, so you were at 100. Professor Menon, can you break it down simply for our viewers a little more about this test? All our viewers didn't go to IIT, they're not students of bioscience, so I know it may not be correct for me to ask you this, but sir, there's so much interest about your diagnostic kit, sir. If you could tell us in simple language on how you developed it and what makes it unique and so affordable and accurate.
So basically, as you may know, many people are talking about this. So what kind of test do we have for COVID-19? So we have the other one which looks for the antibody against the virus. So among the tests which look for the virus, we have rapid test looking for the viral protein, which you call as antigen testing. Then we have the gold standard test where we actually look for viral RNA. So what you normally do is from a patient or prospective patient's throat, you collect samples, you isolate RNA, and then do what is called the polymer amplifying. So increase it in number and then look at it. So that means you're increasing the sensitivity of your assay. Now, then comes the third part, which is detection of the RNA or the amplified product. And that detection, most of the other companies in the market, you can say majority or all of them, are using fluorescently labeled probes for detecting the amplified product. And what we have done is we've gone back to one of the earliest methods of real-time PCR, which is a very basic method using cybergreen, which is a fluorescent dye, to detect the amplified product. So this is the major distinction between our kit and most of the other kits, that they use fluorescently labeled probes, which makes it a little bit more expensive, and also, most of the probe synthesis happens abroad, so makes it a little bit more difficult to scale up. So these two factors and extensive experimentation, we could come up with a PCR which is as sensitive and specific as probe-based method, but at a lower cost. So I think that summarizes, and it's understandable. Yeah.
So, Professor Perumal, let me make this the final question. You did see this diagnostic kit creating a lot of enthusiasm in government circles. They are very proud that IIT Delhi has developed this, has done so in partnership with a private company as well. What is the go-to-market strategy, sir? Is this going to be available in the market across India? What is the go-to-market strategy?
Yeah, so it is going to be available soon, but so we won't be able to comment too much on it, because actually we have about half a dozen licensees, and this is the first company, New Tech Medical Devices, that has gotten all the necessary permission to market it. We have some licensees from the southern part of India as well as some from north of Delhi. So that way, actually, soon we will be able to sell the same kits in India. A lot depends on they can probably start using it for large scale testing. A lot depends on that.
Okay, so we will wait for that, professors, and once it's in the market, here's an open invitation to be back. Thank you from all Indians for making a kit which is so affordable and so accurate, a real moment of pride for India. Thank you both professors for joining us on this Friday's edition of Startup Central. With that, ladies and gentlemen, it's a wrap. I hope you enjoyed the show. We'll be back on Monday, same time, 6 p.m. With an action-packed show, big voices, the latest disruptors.